I've recently stumbled across an entire body of research that has made me question, rethink, and get super excited about anxiety treatment, a therapy approach that really helps clients with anxiety. And I want to share some of it with you in this video in case you know of someone in Los Angeles or California who might be looking for a different kind of anxiety treatment. Now, since I've started implementing this professionally, and to be totally honest, a little bit personally too, I've seen some really interesting changes in my clients. When they get the main principles that I'll share now, the changes in their lives can happen pretty quickly. And as far as I can tell, those changes seem to last. And the really bizarre thing for me is that every day, almost every session, some aspect of this theme comes up. It is everywhere. And I really hope that this video helps more people get it and understand it. So I'm going to show you how this thing called the intolerance of uncertainty is this transdiagnostic risk factor that's at the core of all anxiety disorders, depression, hoarding, and I've not dived into it yet, but there's research on eating disorders, emotional regulation, and many other things. It is so profound and prevalent. It's very, very interesting stuff. But first of all, what is it? Well, there's nothing particularly mind-blowing about what intolerance of uncertainty is. It's the fear of the unknown. But let me make it a little more real and tell you a few ways that showed up for me recently. So, side note, I don't talk about real clients, so these are composite cases and all information is being changed. But I will start with me. So a friend of mine asked me to dinner, and I absolutely love this guy, so of course I said yes. But 2 days before the dinner, I got wind that it was a dinner party, not a dinner and a catch-up with me and him. My excitement and enthusiasm plummeted, and I nearly cancelled because the thought of sitting down for dinner with 6 or 7 people I don't know filled me with dread. So there was a trigger, dinner party. The reaction that I had was hell no, some anxiety, some fear. The behavior I wanted to implement was avoidance, cancel it. And if we had to give that a diagnosis, we'd maybe say that was social anxiety. Another client is planning a trip with friends, and she's stressed out about how to organize the entire thing, how to keep everyone happy, book all the things, and she is on a mission to make this the most amazing vacation ever. There was a trigger, which is vacation with friends. The reaction was overwhelm, a feeling of chaos. The behavior was to manage and control it. And the diagnostic is not official, but maybe we'd put this in a perfectionism category. Another client has been talking about finding a new job and wanted to use therapy as a way to explore what he should apply to, what careers he should do. And there's a lot of anxiety and worry about the current job as well as the future job. So the trigger is something about not being happy in the current job. The boss is a nightmare. The reaction was to run, find a new job. The behavior is research, overthinking, and lots of worry. Maybe we'd say the diagnosis was generalized anxiety disorder. So it sounds like 3 very different clients with very different diagnosis and very different behaviors. But when you think about the core of all of them, it's all to do with uncertainty. So for me, the anxiety that I had came up from the uncertainty of not knowing who the people were, if I'd like them. For other people with more severe social anxiety, it's not knowing or uncertainty about if you're going to be judged or if people will like you. The best coping strategy there is just not to go. So avoidance is a great idea for people with social anxiety. So for my client planning this big trip, I don't think we really talk enough about how planning, researching, and organizing is sometimes anxiously driven, particularly when it's coming from a way to manage or control the uncertainty that came up from going on vacation with all those friends. Will I see all the sights I want to see? Will everyone be happy? Will we all get along? So the best way to deal with that is to plan it, book it, make all the spreadsheets, color coordinate the spreadsheets, organize it, read all the reviews. Because if you have all of the plans, you're literally making things more certain. You are removing uncertainty by making things organized. And the client with the job, this anxiety is obviously to do with uncertainty, right? I mean, literally he came into treatment not knowing what to do, whether he should stay at the current job, not knowing if they should be an actor or an accountant or whatever the other career was. And there's a lot of uncertainty about not knowing if he's going to like those new career options. A massive trap that this intolerance of uncertainty makes us all fall into is the idea that we can Google our way to certainty, that the answer is absolutely out there if you look hard enough, if you research enough, if you find the right thing. So let's research the hell out of jobs, get a career coach, get a therapist, because they will have the answer that I need to make me feel more certain. But there's no answer out there, right? So this is all about how the intolerance of uncertainty leads us into a trap of decision paralysis. If we're convinced that there is one answer that will alleviate this feeling of uncertainty, well, let's just really look for it. And this client, by the way, was quite upfront when they called me. They told me that I was one of 6 therapists he was talking to. So that 15-minute consultation call was a full-on audition again, because this person had to research everyone, because there was an idea somewhere in the back of his brain that there is the perfect therapist, the right therapist. And if you look hard enough, you'll find that person, and then there'll be less uncertainty and we'll feel better. If you're a therapist watching this, the same is true when clients ask you, what should I do? Or what's the homework? Or what books should I read? It's the same sort of thing. They are wanting to alleviate their uncertainty by having you give them the answer. And sometimes that's appropriate, obviously. But if we're not talking about the uncertainty that's driving it, maybe we're avoiding the core issue here. This idea of not being able to tolerate uncertainty makes so much sense to me, and hopefully you're getting it too. But you might be asking yourself, well, there are things in life that make everyone uncertain. Why are some people reacting differently to it than others? One way to think about it is like how I think about anxiety. There's state anxiety and trait anxiety. If you've got an exam coming up, that is a state of being, is situational. Trait anxiety is just part of who we are. We're constantly anxious. The same is true for this ability to tolerate uncertainty. We have state, daily, or momentary uncertainty. This refers to the ebb and flow of uncertainty in your day-to-day experience. Like, I don't know if Trader Joe's is going to be out of my favorite dinner. That might generate some anxiety. Trait uncertainty tolerance refers to this intolerance of uncertainty as this enduring dispositional characteristic. It's more of a general persistent tendency to react negatively on an emotional, cognitive, and behavioral level to uncertain situations. So when I'm talking about the intolerance of uncertainty and anxiety disorders, I'm mainly talking about trait uncertainty. But we can break this down even further too. So imagine this intolerance of uncertainty is split into 2 scales, and you can be anywhere on both. Some clients are hyper planners. They need to control everything. Others don't. And by control, what we're really saying is that they have a high need for predictability. The other scale is to do with how physically and emotionally overwhelmed people get by the mere feeling of not knowing. And you can have a high physical or emotional reaction or a low one. You might be able to think about anxiety attacks now being related to how distressed someone gets with uncertainty combined with a high need for predictability. So if I have a very physical reaction to anxiety, my heart rate goes up, my breathing goes shallow, I turn red, and I have a high need for predictability, then I'm going to be very hypervigilant for changes in my body. And when I notice something off, I might start getting more anxious because I don't know if this is going to be an anxiety attack. And what if it is? What if it is? And what if this is happening now? And then you're off, right? We can also look at worry through this lens too. I'm English, and that means I have generations of worriers in my family. So I find this particularly fascinating. Worry is the defining feature of generalized anxiety disorder, right? And people, myself included, can worry about real things. Like if the company you work for is letting people go, you could be very worried, right? You could have thoughts about being let go, not having a job, totally legitimate. But this intolerance of uncertainty is so much more devious because our anxious brains will generate the most ridiculous, made-up thoughts for us to worry about. So I used to work in Malibu, and I caught myself at one point worrying about what I would do if there was a tsunami. So maybe a little bit of caution is good. Maybe I could find the escape route that I need to take if there's ever an earthquake, sure. But there was a good period, a few days, where I was not so flippant or practically minded, and I was really worried. And it all came from a thought. What if there's a tsunami? Our anxious brains literally make up thoughts that we latch onto that cause or create more uncertainty. What if there's an earthquake tomorrow? What if the asteroid hits planet Earth in 2029? If we're not careful, we can create uncertainty in our own heads and get very anxious as a result. It's self-inflicted. I'm hoping that this little visual and the breakdown shows you that at the core of anxiety disorders is the intolerance of uncertainty. If there is one thing you get from this video, I hope that it's giving you an idea of how to talk about uncertainty, to name it when you're talking to clients or when you're thinking about what is making you anxious. And here's why that's important. Imagine your therapy sessions magically have a view of the ocean, and each week your client comes in and you both stare out over the water. The anxiety-related topics of your sessions are the ships that you can see floating by that the client wants to talk about. One week they're talking about the yacht, the next week it's a tanker, another week it's a speedboat. Or perhaps for months on end, you're talking about the damn tanker constantly. The point is this: anxiety-related thoughts. Should I quit my job? Should I leave my boyfriend? Should I go to that dinner party? Those are all ships on the ocean. They change over time. But what we really should be talking about is the thing that they all have in common, and that is the body of water that is holding all of these ships up. It's the thing that all of the thoughts have in common, right? Effective anxiety treatment is not about the boat. It's about the uncertainty and how we can or cannot tolerate it. And helping people grow their capacity to tolerate uncertainty is actually the key to treatment and the best practices of intolerance of uncertainty. So in general, this approach is not about treating the symptoms of anxiety. There's no mantras or breathing techniques being taught. So this intolerance of uncertainty and what to do about it is at the core of my approach to anxiety treatment and therapy approach in Los Angeles. I've got a 6-week group therapy program starting soon. I've also got an incredible team of therapists who also run groups based on the curriculum I've created. Sure, things like that have a time and a place, but they are triage. It's a band-aid for a moment in time. It would be treating one of the ships on the ocean, but there's going to be another boat coming by soon. I want to help people fundamentally shift their relationship with anxiety, and that means taking a deeper dive. It's more strategic, it's more efficient, and ultimately it's more helpful. If you have questions about anxiety treatment, how I work, what I do, more about this work, you want to talk to me about what's going on for you, drop me an email. Hit follow, leave a comment. I'd be happy to chat more.